Hearing loss is a common part of aging. It affects about 1/3 of all adults between the ages of 65 and 74, and up to half of those over the age of 75. Being in denial can be a common response to hearing loss, particularly among older adults. My hearing's not that bad. Wearing hearing aids means I'm old, and I'm not ready for that. I don't like the way hearing aids look. I heard that hearing aids are difficult to use. Hearing loss in seniors is more than just needing to crank up the TV volume. It brings a bundle of challenges, like struggling to hear doorbells, missing alarms, feeling lost in social situations while shopping or doing errands, and facing difficulties in understanding medical advice from doctors and pharmacists. What's even more concerning is that hearing loss is not just an inconvenience. It's tied to various health issues, with dementia taking center stage. Let Derek tell you how much hearing loss affects dementia. Recent research in aging doesn't just hint at a connection. It shows some compelling evidence. In a long-term study covering almost 12 years and involving 639 adults, Dr. Frank Lin from Johns Hopkins University and his team uncovered some eye-opening findings. They found that even a mild hearing loss doubled the risk of developing dementia. If someone had moderate hearing loss, that risk tripled. And for those with severe hearing impairment, the chances of dementia shot up fivefold. These findings highlight how closely our hearing health is linked to our cognitive well-being as we grow older. This study marked a pivotal moment that piqued the interest of both healthcare professionals and the general public. In a similar prospective population study, conducted by Richard Gergel and colleagues from the University of Utah, 4,463 subjects without dementia at the beginning of the study were followed, out of which 836 had hearing loss. Just as the study by Lin had suggested, the findings reinforced the idea that hearing loss could independently predict the development of dementia. It also indicated that hearing impairment might serve as an indicator of cognitive dysfunction in adults aged 65 and above. In another prospective study, conducted by Thomas Fritz and the research team, a much larger population of 154,783 individuals, aged 65 and older, was examined. They utilized claims data from the largest health insurer in Germany and tracked these individuals from 2006 to 2010. During this period, 14,602 dementia diagnoses were recorded. The analysis accounted for potential confounders, such as gender, age, and comorbidities. The results revealed that individuals with bilateral hearing impairment had a higher risk of developing dementia compared to those without hearing loss. In the 2017 Lancet Commission report, researchers employed population attributable fractions (PAF) to illustrate the potential impact on future dementia incidence if the most influential factors were successfully eliminated. According to the report, the ApoE4 allele, lower education levels, smoking, physical inactivity, and hearing loss are identified as the top 5 factors with a high PAF. Notably, hearing loss holds a significant PAF value of 9.1%, positioning it as the leading risk factor. This data highlights that individuals experiencing hearing loss are at a heightened risk of developing dementia. In a follow-up report by The Lancet in 2020, it was revealed that, by effectively addressing all 12 risk factors over the course of a lifetime, it would be possible to prevent or delay dementia in as many as 40% of cases. Remarkably, among these risk factors, hearing loss emerges as the one with the most substantial potential to significantly delay the onset of dementia. Derek talked a lot about the significant connection between hearing loss and its profound influence on dementia. Now you're likely curious about how. There are several ways that hearing loss could lead to dementia. To understand how this happens, let's explore 3 theories about how hearing loss affects cognitive decline: the common cause hypothesis, the cascade hypothesis, and the cognitive load theory. The common cause hypothesis postulates that both hearing loss and cognitive decline are the results of a common neurodegenerative process in the aging brain, but that one does not cause the other. It leads to the development of both age-related hearing loss, ARHL, and dementia. One example is microvascular disease, which can lead to reduced blood flow to the inner ear, as well as cognitive centers of the brain. Resulting ischemic injuries in these structures may impair normal functioning and give rise to both hearing loss and dementia. However, previous analyses have shown that even when vascular disease risk, including coronary artery disease, diabetes, hypertension, and history of stroke are taken out of the equation, the relationship between hearing loss and dementia still exists. In addition to vascular degeneration, it is possible that other neuropathologic processes affecting both the brain and peripheral auditory structures may underlie this relationship. If this is the case, treating the common neurodegenerative process might help both conditions. The second is the cascade hypothesis, which suggests that auditory deprivation affects cognition directly via impoverished sensory input, as well as indirectly through a decrease in socialization, probably leading to depression. A lack of sensory input, including sound, directly affects brain structure. Though we hear with our ears, we understand with our brain. Therefore, if our ears are not functioning properly, they cannot effectively activate or stimulate the brain. Since the brain is no longer receiving stimulation from sound, it begins to weaken and atrophy, leading to cognitive impairments such as Alzheimer's. According to Lin et al., researchers found that brain atrophy leads to a size decrease of the auditory cortex and is directly associated with hearing loss. The other effect of hearing loss is a decrease in social engagement. The less a person hears, the less he can effectively contribute to conversation. Eventually, the lack of interaction will lead to depression, anxiety, and social isolation. Social isolation, loneliness, poor verbal communication, and depression in turn cause cognitive decline. If so, restoring hearing might not allow hearing loss to cascade via these factors into cognitive decline. The third hypothesis posits that hearing loss can exert significant demands on the brain, ultimately leading to cognitive decline. This concept is known as the cognitive load theory and suggests that hearing impairment depletes cognitive reserves, resulting in cognitive deficits. A study conducted by Jonathan Peely explored the impact of hearing loss on brain activity. They used functional MRIs, fMRI, to observe how the brain responds to auditory tasks. Here's what they found. The researchers divided participants into two groups. Both groups were similar in age. One group had normal hearing, while the other group had mild to moderate hearing loss. During auditory tasks, they looked at which parts of the brain lit up. In the group with normal hearing, there was strong language-driven brain activity in the primary auditory cortex, responsible for processing sound. In the group with hearing loss, even if it was mild to moderate, the primary auditory cortex showed reduced activity. This was due to the reduced auditory input caused by hearing loss. What's intriguing is that people with hearing loss also exhibited increased activity in the prefrontal cortex, a region associated with higher-order thinking and learning. This area seemed to be recruited to help cope with the hearing challenges. In summary, the study found that even mild to moderate hearing loss can lead to reduced auditory cortex activity, but increased prefrontal cortex activity, suggesting the brain's efforts to compensate for hearing difficulties. Hence, it imposes a cognitive load on the brain. This research sheds light on the cognitive impact of hearing loss. Now, let's delve into the details. When individuals with hearing loss engage in processing complex speech, the brain might recruit compensatory brain regions, such as the prefrontal and temporoparietal cortex, to sustain language comprehension, even in advanced stages of dementia. While this compensatory mechanism may aid in language skills, it can deplete cognitive resources required for other cognitive functions, including working memory and perceptual processing. This, in turn, may exacerbate the impact of Alzheimer's disease, particularly when coupled with other factors like amyloid tau accumulation. The question then is, if we treat hearing loss in older adults, does that reduce cognitive decline as well as possible risk of dementia? In a 25-year prospective study involving 3,777 individuals aged 65 or older, an increased incidence of dementia was observed among those who reported hearing problems, except for those who used hearing aids. A nationally representative survey in the United States, encompassing 2,040 participants, aged 50 and above, and conducted every 2 years over 18 years, revealed that the decline in immediate and delayed recall was less pronounced after the adoption of hearing aids. The extensive follow-up periods in these prospective studies strongly imply that hearing aid use has a protective effect. So how can you maintain your brain health? Here are a few tips. Keep on learning. Any new learning activity develops new neural connections in the brain, which may help you bypass any damage to the brain associated with dementia. Be social. Having conversations with people will stimulate your brain. Exercise, at least 30 minutes, 5 days a week. Cardiovascular exercise is particularly beneficial. Eat healthy. Eat lots of fruits and vegetables, along with legumes, fish, olive oil, and nuts and seeds. But remember to also take good care of your hearing. Because it's important to keep your brain healthy, it's also important to keep your hearing healthy. So don't let your hearing loss increase over time. If you suspect you have a hearing loss, get help. Start by taking a hearing test. Hearing aids are a good way to treat your hearing loss if it's low or moderate, depending on your specific type of hearing loss. If you have a severe or profound hearing loss, cochlear implants may be the best option for you. If you found this information enlightening, don't forget to give us a thumbs up, share this video with your friends and family, and hit that subscribe button to stay updated with more valuable insights on health and well-being. We'd love to hear from you, so please feel free to join the discussion. Ask questions or leave comments below. Your input is incredibly valuable to us. Thank you for watching. Take care and stay well.